Hello everyone, I am Achyut Patil, working as a Joint Director at CDCI Pune, India. I am also working as a technical lead in National Resource Center for EHR Standards. I am here to present the Common Drug Codes for India, CDCI. To give a big background before I explain about the Common Drug Codes for India. So here, Ministry of Health and Family Welfare, Government of India has notified EHR standards for India in August 2013. The subsequent releases has been revised in December 2016. To take a first step after that, the India become a member of SNOMED International in September 2014, and Ministry has set up National Release Center for SNOMED CT at CDCI Pune. To work National Release Center for SNOMED CT for close to 2 to 3 years, Ministry has set up a Center of Excellence called as National Resource Center for EHR Standards for adoption and implementation and the promotion of notified EHR standards at central and state level. So we are currently working as a National Resource Center for EHR Standards and as also a part of the National Release Center. So after that, Ministry released the National Digital Health Blueprint (NDHB) in 2019, with specific mention on use of digital health standards covering different aspects like content, exchange, security, etc. So in both EHR Standards for India 2016 guideline and as well as National Digital Health Blueprint, the SNOMED CT has been notified as a primary clinical terminology for all sort of clinical information, codification of the clinical information. So what is the impotence of development of CDCI? It's a requirement and the cater to national needs of coding medications in EHR that enables nationwide single standardized codes for use in healthcare system efficiently and unambiguously. And the aim was to develop the standardized drug corpus and the codes for India that can be used across healthcare system. So these standardized drug codes will be enable linkages to the terminology and the use in applications or the systems, such as for the clinical documentation, for in e-prescription systems, for data encoding and the retrieval, and also for the reporting and analysis purpose. The stock management and the supply chain management applications can also be built on top of the CDCI, as CDCI is currently, these type of systems are not facilitated in current CDCI development. So we can build these particular systems, the stock management and the supply chain management on top of CDCI, which will give the added advantages of using the CDCI. Hence, the CDCI as national extension to SNOMED CT has been developed to fulfill the requirement of every IPD and OPD for capturing of the medication and the drug information. So the common drug codes for India are distributed and it is available in two different formats. One is CDCI as a terminology integrated package, is an extension to SNOMED CT, and it is accessible through MLDS to all the registered affiliate licenses. And secondly, the CDCI as a flat file package that enables integration of drug codes in healthcare applications without need of integrating a complete terminology. And these are available as a tab separated values in a text files. Along with these two packages, we also distribute the drug information service bundle. This is an additional deliverables as an output of drug corpus collections and the corrections. This drug information service bundle provides the additional reference and the knowledge or the information about the drugs, such as what is the indications, contraindications, class of drugs, drug-to-drug interaction, excipients for the substance. So these additional information we provide as a part of this package. If we talk about the current coverage of CDCI, we have modeled all the generics and medicines referred in these all national programs, guides, and lists. We also provide standardized drug corpus and the codes for substance, generics, brands, package details, dose forms, route of administration, product names, and the suppliers. We also modeled COVID-19 vaccine products from India, uh, such as Covishield, Covaxin, and Sputnik V. If we talk about the current statistics about the coverage and the model drugs in latest release of CDCI in August 2022 release, along with the international version, we have more than 8,200 generics and more than 42,000 branded medicines we have modeled till now. We have also given a content request of around 349 for the substance and the clinical drug added in international edition through SNOMED CT content request service. So the National Health Authority of India, who is primary responsibility of execution of Ayushman Bharat Digital Health Mission, has envisaged use of CDCI to be used in listing drugs over National Drug Registry, which is one of the building blocks of ABDM, and Drug Information Exchange in health records. So why we choose a CDCI for the development as a national extension to SNOMED CT? There are few obvious checkpoints for us before developing this, such as the SNOMED International already covering the substance, which are nothing but the active ingredients, the medicinal products, the comprehensive clinical drugs, which are generic list, dose forms, and the route of administration. These all are already in standardized format in the SNOMED CT. SNOMED International also provides SNOMED CT drug model for supporting national extensions for where the guidelines regarding modeling of the branded medicine is available. This also allows to keep the same format and the structure of distribution similar to the SNOMED CT, which helps to ease of the system integrators. In India, SNOMED CT is already adopted, and Ministry has made SNOMED CT available for free of cost for standardizing clinical information in EHR. Hence, the distribution of terminology package is also free of cost for all the SNOMED CT affiliate licenses within India. Whereas flat file package is freely downloadable, available on the website. So there is also, as a NRCeS, we have developed a free and open source toolkit and the APIs for the integration of SNOMED CT, through which as a national extension also can be imported and use as a import and use in the healthcare application. Hence, the standardized drug codes as an extension to SNOMED CT will help the system developers to adopt and implement a single clinical standard to standardize health data. So here is some modeling example about the branded medicine, which are nothing but the real clinical drug. So here I'm giving an example of Tramod as a product, which has a Tramod also. The FSN formation and the synonyms formation all are taken from the SNOMED CT drug modeling guide. So the Tramod is nothing but a product name, the tramadol of a substance, which compromises the FSN along with the product name, substance, strength, unit, dose form, the supplier name, and the semantic tag. This is how the FSN we formulate in the CDCI, and we also give different flavors of the synonyms, such as with the product name, strength, unit, and dose form, along with the substance name, and also along with the manufacturer's name. So these all we have included for the modeling for the in the description components. So this is the example of real medicinal product, which has linkages for the medicinal, which is product name and the supplier name. And this is how the modeling diagram is. And if I would like to show the RCD's modeling guide, so this is a modeling diagram for real clinical drug. where there is a linkages to the clinical drug as well as the real medicinal product. And the other are the additional attributes for the RCDs. So there are few tools and technologies that we use for the development of CDCI, where we have in-house developed the drug information authoring tool. This is a web application to support the curation and curation of the medicine and the generic. All the medicines and the drugs entered into the diet goes through the two-step review process with various roles, including user, review, and the staff. We are also using few of the services from the authoring platform service stacks provided by the SNOMED International, such as the RVF framework, the classification services. The diet tool itself take cares about the generation of the flat file package, where we have provided a service for generation and the export of flat file package from the terminology integrated package. So this is a workflow of diet where a few of the users, specific users assigned to the specific roles, there are the different users like hospital, doctor, the manufacturer, or the regulatory bodies, and there is an authoring body which has specific roles assigned in terms of the user, reviewer, and staff, and they have a specific privileges that who can add, who can update, and who can review or who can approve those particular drugs in the diet. And finally, once the drug has been approved, those will be released as a part of common drug codes for India, and they are exported in the different packages like terminology package, flat file package, and the drug information service bundle. So the CDCI release preparation process goes through like this. So we feed the data for the curation and the for the creation in the drug information authoring tool. Then it is exported in the stated Axiom files and given to the classification services of SNOMED International, and that we have hosted and deployed at our local cloud system. And through the classification, the inferred files are generated, which we finally give to the release validation framework, and the validated RF2 gets exported, and those will be a final release files that we distribute. If we talk about the different milestones and the progress of CDCI releases, so way back in January 2018, where the journey has been started, the first beta release of India drug extension of SNOMED CT has been released, where we have modeled only 1,000 clinical drugs from the national programs that only includes the tablet for the tablets and the capsules. Then in November 2019, the first developer preview we have released, along with where we have distributed both the packages as terminology integrated package and the flat file package. In August 2020, the first time the production release has done. Then in this year, we have started with the periodic release from the June, where we have a periodic release of every monthly cycle, and current latest release is August 30, 2022. So I'll give you a quick demonstration about the CDCI integration in e-prescription record. So where we have designed a e-prescription demonstration page where I already filled in few of the contents from the SNOMED CT itself, where for the chief complaint, few of the entries I have already taken it from the SNOMED CT, the diagnosis that we have asked for, and for the medication, the CDCI integration is here. So we have categorized the medicine into different things for the generic as well as the brand medicine. If we select the generic, then we can filter out the data only from the generic. I select the azithromycin 500 mg oral tablet. So the dose form and the route of administration has auto-filled. So we can give some dose and the dosage instructions we can add. So this is how the medication has been added for the prescription. If we select for the similar thing, if we select the brand medicine, then also we can add the branded medicine in a similar fashion. So this is how we have given a privilege for the doctors to enter whether he wants to give a generic medicine as well as the branded medicine. So and if we talk about the drug information service bundle, so this is how the information we provide for the generic drugs for the azithromycin 500 mg oral tablet, the indication, contraindication, dose forms, the type of drug. So these all information we provide as a part of drug information service bundle. So if we click on the branded medicine, the information we can see is the medicine name, the branded name, the generic link to this particular brand medicine, the manufacturer name, and the other details. We can click on the preview. So it will create the prescription for the doctors. So on top of that, we are also currently as an NRC, we have provided another extension called as patient instruction extension, language extension, where, as you know, in India, we have multiple languages for the references, and doctor wants to provide the prescription in their local languages. So in patient instruction language website, we have translated the SNOMED CT terms, patient instructions in multiple languages of India, like say for example in Hindi. So the instructions are translated in those particular languages, in Hindi, in Tamil language, in Marathi, and in Urdu. So doctor can give a specific in language prescription. He can print out and provide or transfer to the patient in their local language. So if we talk about the scale of usage, who all are currently using the CDCIs? So conservatively, more than 150 plus healthcare applications deployed in different states of India are used, these applications has been used by many clinicians and the hospitals. There the CDCI has been integrated, and they have intensively using CDCI for in the electronic health record. So these are few of the well-known organization and the healthcare application that is been deployed all across the states of India. Being one of the e-Sanjeevani OPD application, it has been world's most worldwide use, the most comprehensive implemented telemedicine application where the CDCI has been deployed, which has more than 3 crore of consultation happened in past 2 to 3 years. That is where the CDCI has been integrated. And also with the adoption of National Health Authority, who has already envisaged the CDCI to be part of National Drug Registry, then will be used nationwide by all the healthcare applications and the pharmacy. So the reach and the integration will be used by all the applications that is been available in India. So these are few of the compliments and the testimonials that we have received from the integrators and the active users of NRC India, who has complimented for adoption of not only the CDCI as a standardized drug codes, but adoption of CDCI as a national extension to the SNOMED CT, because they are already been using SNOMED CT, and does not have integrated any other standard for the same clinical information. So They are very happy that the CDCI is an extension to the SNOMED CT, and they are adopting the standard. Yeah, that's it. Thank you so much. Thank you so much for giving me an opportunity to represent NRC India and talk about the common drug codes for India.
Thank you very much, Achyut. Now, we just have time for just a few quick questions. As a reminder, if you're in the room, please use the microphone to ask your questions. Maybe just one question, if anyone has one. I have a question, Achyut. What are the future plans for this work?
So currently, we are planning for more and more branded medicine at this moment because India has a large capacity, not in terms of the capacity, but more branded medicine coverage, as well as the national programs that we wanted to cover. Because the National Drug Registry is coming into the picture, and the CDCI will be used as a listing in the National Drug Registry as a core part of it. So current in the short term goal is to have to increase the coverage for us.
Okay, lovely. With that, we will conclude this session. Thank you very much, Achyut, and apologies everyone for the technical difficulties earlier. Online delegates can join another session through the event lobby, and on-site delegates, if you're playing the event game, please scan the QR code by the door to capture your attendance. Thanks very much, everyone.
Thank you.